Hi, and welcome to Emory. Many TV shows and movies would have us believe that the college experience and alcohol use are synonymous. Even some parents and professors think that is the case. But that may not be your experience, and certainly it isn't the experience of most Emory students. How do we know? We ask them. And in this day and age, students will share almost anything. I mean, have you seen Snapchat? So, why are you watching this presentation? You're going to learn a lot more about the ins and outs of alcohol use and its effect on the body and its effect on campus climate and campus culture when you take Alcohol EDU later this summer. But in this short presentation, we're just going to focus on a few things specific to Emory. So of course we have to say that you must be 21 or older to drink legally in the United States, and that's our expectation for you here at Emory. Now, you may have heard about studies showing that there are health benefits of alcohol. Studies have shown some positive aspects of moderate alcohol use, especially in preventing heart disease. But there are a few important things to keep in mind about those studies. First, moderate use is defined differently in different studies. And just to preface all of this, you need to pay attention to who is funding the studies. So as far as what is the construct of moderate use, generally that's defined as no more than 1 drink per day if you have a female body, or 2 drinks per day if you are male-bodied. And binge drinking, as you may already know, refers to having 5 or more drinks in one sitting. This type of drinking behavior does not have any health benefits. And no, you can't save up your daily allowance and drink them all at once. Age is also an important consideration. Alcohol may not help prevent heart disease until you reach an age at which you're at greater risk for heart disease, which generally starts from about 45 to 50 years old. For some people, including people with a family history of alcoholism and women at elevated risk for breast cancer, the risks of moderate use may outweigh the potential health benefits. If you're looking to add more antioxidants to your diet, fruits and veggies have the same potential benefits without the associated risks of alcohol use. If you want to get more information, check out these links. All right, well, what can we tell you about alcohol use at Emory? Remember that survey I mentioned in which students were very honest with us? Well, let's look at alcohol use at Emory's campus. Keep in mind that binge drinking is defined as 5 or more drinks in one sitting. According to a survey we did with Emory students in the fall of 2014, so just about a year ago, this was the National College Health Assessment Survey, almost 1/3 of Emory undergraduate students reported that they don't drink alcohol at all. Just a little over 1/3 drink in lower risk ways, and about 1/3 report binge drinking. Then if we think about first-year respondents a year ago, so the people who were in your seat, getting ready for orientation, getting ready to come to Atlanta, getting ready to come to campus, those folks reported last year when they were first-year students that almost 40% of them didn't drink, that about 30% drank but did not binge drink, and that about 32% binge drank 1 or more times in the past 2 weeks. This is just to show you that what you're seeing may not be what's actually happening as far as normative behavior on campus. All right, so occasionally you'll hear us talk about low-risk drinking or drinking in low-risk ways. Generally, this means consuming moderate amounts of alcohol if you're of age. These guidelines can be helpful to keep in mind. It's also important to think about the fact that if you're underage, or if you're taking certain medications, or if you have a genetic history that predisposes you to substance use, or if you have your own personal history of risky substance use, not drinking at all may be the right decision for you. Otherwise, when we talk about low-risk guidelines, we're talking about no more than 4 drinks on any specific day for men or male-bodied people, and no more than 3 drinks on any specific day for women or female-bodied people. And again, you can't save these up and drink them all at once. The low-risk guidelines are based on standard drink sizes, which is not equivalent to the amount of alcohol that a cup can hold. It has to do with the volume of alcohol in a particular serving. So take a look at the picture and think about if you drink the kinds of drinks that you usually have. For example, if you fill a wine glass to the top, that is going to be probably 2 to 3 servings instead of just 1. Also, if you were to fill up a whole red Solo cup, for example, which we'll see in a minute, that would be more than one serving oh, sorry, this is a shot glass. Yeah, if you were to fill it to the top, it's going to be more than one serving. A beer is a standard size. A 12-ounce can of beer is a standardized serving of beer, so that's a good way to keep that in mind. All right, so people drink for a reason, right? For those that choose to. But drinking more and more alcohol throughout an evening or an event does not result in feeling better and better. At a blood alcohol content, or BAC, of 0.03 to 0.05, many people report feeling more relaxed, less anxious, and able to interact more easily with other people. At higher BAC levels, however, people begin to feel the depressive effects of alcohol, including impaired judgment, decreased motor skills, possible loss of consciousness, and risk of alcohol poisoning. So initially you feel really good, but the more you drink, then you're starting to have a feeling of being down, of being depressed. Then you also have issues if you're developing intolerance, and then you may move into unconsciousness or alcohol poisoning. This is called the biphasic response to alcohol, and what we really want to point out is the point of diminishing returns. So if you're drinking in a low-risk way, you're going to maintain that good feeling without suffering perhaps some of the negative consequences. If you choose to drink, there are strategies you can use to maintain a low BAC level and decrease the chance of negative consequences associated with drinking. First of all, as Julie tells us, set a limit for the number of drinks you'll have and stick to it. Suggested limits to lower your risk would include 3 or fewer drinks for female-bodied people and 4 or fewer drinks for male-bodied people. Keep in mind the standing serving sizes, and filling it to the top is not one serving. These helpful little lines on that Solo cup can help you keep track of your servings. Filling it up to here is a serving of beer. This would be a serving of wine, and this little line just barely covering the bottom of the cup is a whole serving of hard liquor. You can pace yourself and stay within your limit. Try drinking a non-alcoholic beverage in between drinks with alcohol. This will also help keep you hydrated. Avoid drinking games that encourage fast consumption. Food can help slow the body's absorption of alcohol and avoid increasing your blood alcohol content faster than you realize. However, if someone is already heavily intoxicated, asking them to eat something may not be a good idea. They could actually choke or cause further harm. You want to be sure you stay hydrated. You can also choose not to drink. Taking a night off doesn't mean you can't go out. Red cups can hold water too. And consider what medications you might already be on, or just how you're feeling. If you're already feeling kind of down, that's probably not a good time to drink. And if you're taking prescription medication or street drugs or something that you're not familiar with, then that is not a time to drink either. And be sure to check in with your friends. We know this can be tricky in your first few days on campus because you're just getting to know the people around you and figuring out who you can trust. But keep in mind, or keep handy the names and phone numbers for just a few people, and look out for each other. If you're worried a friend might have alcohol poisoning, call 911 or Emory EMS at 404-727-6111. And if you're not sure what to look for in evaluating whether your new friend might have alcohol poisoning, remember the acronym CUPS. CUPS stands for cold skin, unresponsive, puking, and slowed breathing. If you or a friend are showing any signs of this distress, get help. Don't worry about getting in trouble. We have a medical amnesty protocol in place to be sure that students get help without fearing the repercussions. You can call 911 or Emory EMS at 404-727-6111. In fact, it might be a good idea to go ahead and put this phone number in your phone now. As I mentioned, Emory has a medical amnesty protocol, as do many colleges and universities nowadays. Emory expects all community members to follow state and local laws. However, if a student does require medical attention related to alcohol or other drugs, it's important to call 911 for help. Emory doesn't want fear of getting in trouble to prevent anyone from calling for help. For this reason, Campus Life developed the medical amnesty protocol. And you can learn more by watching this video created by Emory students for Emory students. Medical amnesty is a process that students can go through instead of the conduct process. It applies to students who need and sought medical attention. It includes educational components like a session with a counselor at the Office of Health Promotion. And if completed, the alcohol-related incident will not be recorded on the student's academic record. Here's a little bit more about medical amnesty. If you have questions, feel free to contact us in the Office of Health Promotion. Thank you and have a great day.